This is case 20 by Mackenzie Harpine, Rebecca High, Ashley Lambert, William Morales, and Michael Hagerman.
In case overview, Lawrence, 49, began to develop skin lesion covering his ear. He went to a dermatologist and was prescribed hydrocortisone cream and oral prednisone. When he was weaned off the steroid cream, the lesions began to reappear. The lesions were biopsied and a hematological screen and blood smear was performed. It was later discovered that his mother had tested positive for HTLV1. After the test and diagnosis of cutaneous T-cell lymphoma, Lawrence was prescribed with long-term topical fluorouracil, oral zidovudine therapy, and annual dermatological screenings.
For jargon, Sézary lymphocytes are T lymphocytes circulating in the immune system that mature in the thymus. Many times when Sézary lymphocytes are present, there are also malignant T lymphocytes in the peripheral blood that clonally match malignant T cells found in the skin. CD4 is a glycoprotein that is found on the surface of immune cells such as T helper cells, monocytes, macrophages, and dendritic cells. CLA is conjugated linoleic acid and is the most common omega-6 fatty acid typically found in meat and dairy. Our gentleman that you're going to find out who at the end is a celebrity consumed a lot of meats and proteins during his career. CCR4 also tested positive in the Sézary lymphocytes. It is a protein that in humans is encoded by the CCR4 gene. It's a receptor for CC chemokine, MIP1, RANTES, TARC, and MCP1, and a disease that is associated with CCR4 is peripheral T-cell lymphoma. The CCR10 is a chemokine receptor that is a type 10 receptor coded by the CCR10 gene, and a disease associated with that is cutaneous T-cell lymphoma. We saw that his mother was diagnosed with HTLV1, which is human T-lin trophic virus type 1, and is a retroviral infection that affects the T cells. The virus can be spread from mother to child during birth or breastfeeding, which is most likely when Lawrence was affected. The virus generally shows no signs or symptoms, but some people can be affected later in life and develop adult T-cell leukemia. He was treated with the fluorouracil, which is an anti-metabolite medication, usually prescribed in a topical cream that is designed to kill fast-growing cells like abnormal cells from malignancies such as basal cell carcinoma, which is a skin cancer. He was also given oral zidovudine therapy, which is a medication also known as AZT, azithromycin. It is an antiretroviral medication that is now used to prevent and treat HIV and AIDS. But at the time that Lawrence was being treated for his cancer, the drug was used as an anti-cancer agent, but it yielded modest results, so they chose not to use it for that any longer.
So this is the test results slide. Our patient got the lesion biopsied and a hematological screen done, as well as a blood smear. This picture on the left shows the biopsy of the lesion, and the picture to the far right shows the blood smear. On the left, you can see that there's something irregular on the surface of the skin in the epidermal layer, and then you can see how it goes down below the surface into the dermal layer. The blood smear showed that his lymphocytes were positive for CD4, CLA, CCR4, and CCR10. Then the bottom picture shows the PCR analysis of the skin and the blood sample. A shows the results of the skin sample, and then B shows the results of the blood sample. And as you can see, there is a visible spike at the 228 level for both, and it was even higher on the blood sample.
Okay, so next we're going to talk about the normal test results. And out of these test results, the main one that can actually show between normal and in his case, not normal, would be the TCR analysis. And where his show the spike at the 228th base pair, this is not normal due to there being a relatively equal amount all throughout the TCR. The PCR analysis, of course, has to do with the polymerase chain reaction, which is used to take a small sample of DNA and rapidly reproducing it to make a larger sample for them to work with. And then the TCR analysis is used to determine immunological abnormality, and it's useful in determining treatment effects on T cell lymphomas and also T cell blood cancers as well.
Okay, so the two topics for background in this case are T cell development. The development of these T cells occur in the thymus. The hematopoietic stem cells originated from the bone marrow. They develop into lymphoid progenitors, and then they move into the thymus where they mature into functional T cells. They develop their specific markers within the thymus as well. These markers include their TCR, CD3, CD4, or CD8, and then the CD2. These allow for them to efficiently carry out their processes of suppressing the antigens found within the body. The lymphoid cell markers are cell markers that, as stated, they kind of allow the cell to do what they need to do. They recognize antigens, they can activate whatever function necessary, as well as inhibit said functions. They also allow for the distinguishment between T and B cells as they develop different markers that allow them to carry out their specific processes.
So this is the question slide, and question 1 is cutaneous T cell lymphoma produces cells which migrate into the dermal layers. What causes these cells to have this specific target area? So this is because the dermis layer of the skin has more immune cells, such as the alpha beta, the gamma delta T cells, dermal dendritic cells, innate lymphoid cells, natural killer T cells, macrophages, and a lot more. So the T cells recognize and respond to infected areas, and the majority of these are in the dermis layer, and that is why the dermis is the specific target area.
Okay, question 2 is the cells that were most active in this lymphoma were non-traditional gamma delta T cells. The main difference between these cells and the normal alpha beta cells are, firstly, their glycoprotein chains, which is what they're named after. They have the gamma and delta glycoprotein chains instead of the alpha beta found in the usual. The biggest factor with these is that they're able to function without the MHC, so they're MHC dependent and don't really need to use the system's MHC to recognize antigens that aren't normal in the body and start attacking it. Then question 3, which is gamma delta T cells are one of the leukocytes which target rumors. They recognize them due to the small mutations found within the tumor cells that allow them to continue growing. Seeing as they are from the body, it doesn't allow for other T cells to find it, because the MHC kind of protects those cells from being recognized as abnormal. However, with the gamma delta T cells, they don't require the MHC's markers to function, so they're able to distinguish the mutations found within it and attack it as it is able to recognize that it's not normal. And these cells have also been studied as recently as 2020 as a possible treatment against cancers for their specific functions.
Question 4 is, why is it significant that the PCR analysis shows primarily one version of the TCR? What does this indicate about the development of the lymphoma population? This is significant that the PCR analysis shows one version of the TCR because the TCR is normally very biodiverse. It has very equal diversity throughout, and showing that there is a spike in one area of the TCR will lead to a lack of coverage against certain types of antigens. And in this case, this indicates that the lymphoma population is able to easily reproduce because the TCR won't be stopping it. Our celebrity is Mr. T, Lawrence Turod. And of course, you know, he would pity the tumor that tries to attack him. And those are our works cited.